Integrative medicine shifts the orientation of medicine from one of disease to one of healing and uses natural, less invasive interventions before costly, aggressive ones whenever possible. Today on 15 Minutes with Longevity, we'll be speaking about how this works in conjunction with Western medicine. Dr. Riaz Motara, who is a cardiologist from the Heart Wellness Center in Melrose Arch, focuses on integrative medicine and its link to heart health. Good evening, Dr. Motara, and thank you so much for being on the show today.
Good evening, Tidi, and thank you for having me on your show.
Now, this topic is probably seen by a lot of people, especially one from a patient point of view, as a confusing one, but from a doctor point of view, it's been a good source of controversy. Can you tell us in simple terms, what is integrative medicine and what other terms are there that implicate or are similar to this kind of practice?
Integrative medicine is a term or a discipline that looks at prevention rather than cure, or prevention rather than treating a sign-symptom complex. In the past, it's been called anti-aging medicine, and that perhaps has been the wrong term for this particular field of medicine.
Why do you say so?
Anti-aging medicine has negative connotations. It may refer to the aesthetic side of medicine only, so for example Botox and fillers, whereas anti-aging medicine or integrative medicine is much more than that. More recently, the term functional medicine has been used, and I think that's a more comprehensive term
Yes.
to describe this new field of medicine.
What is the difference when you try and compare? You know, in medicine, you have to compare, is this better than the other? So integrative medicine eclipses the traditional models in what values or principles?
So if you look at the way in which we were trained as doctors,
Yes.
we were trained to become largely organ specialists. So you're trained to become a cardiologist or a neurologist or a nephrologist. But our bodies, Tidi, don't function like that. Our bodies don't function as a heart only or a brain only. Everything functions in an integrative manner. And a problem with one will usually affect the entire body rather than just that particular organ system. Also in traditional medicine, we were trained largely to look at particular signs and symptoms and then automatically think of a medication that's designed to treat that sign or symptom complex. And we have forgotten, as doctors, I believe, that look at the person as a whole, look at the environment in which they live, look at the emotional stresses that they go to, where do they work, what infections do they get exposed to, and look at their nutrition rather than at their diet. And when you start looking at a patient more holistically, you are able then to determine the cause of their problem. So illnesses don't just happen out of the blue. They will happen at a specific time in your life, and you need to ask that why and when question. Why not 5 years earlier? Why not 10 years later? What is different in your life that's creating the problem?
So if I'm correct, the key difference here is you're looking at the person's health care and how it functions as an ecosystem rather than an island in terms of being an organ specific target when you're looking at how you treat disease, how you prevent disease. But Doc, here's the thing. A lot of people who've heard these terms, functional medicine, anti-aging medicine, integrative medicine, assume that it comes with a lot of money. Is it more expensive going this holistic route? Shouldn't we just really focus on the traditional specialist GP structure?
I don't believe so, Tidi. I believe that it may appear to be expensive in the short run, but if you weigh up the cost of patients being on chronic medication or lifelong medication, if you calculate that a patient may be on an antihypertensive, an antidiabetic, an antidepressant today, just to name a few classes of drugs, and you calculate that lifelong cost for that patient and for the health system, and the long-term implications of the patient being ill in and out of hospital, then the cost of that type of approach far exceeds a preventative approach.
So there is here, and in summary, from a medical point of view, the call of integrative medicine is really not only to save a life from a complication and risk reduction, but also saves medical costs long term.
That's correct. That's
okay.
correct.
I would like to zone in a little bit on you as a clinician at the moment. You are obviously, from a medical expertise point of view, a cardiologist. What inspired you to take the transition, knowing you could get the criticism of some of your more esteemed colleagues?
Well, see, 12 years ago, when I started off in private practice, I was the youngest kid on the block, and I felt that I was going to save lives and make a huge difference to my patient base. And about a year or 18 months after I started private practice, I was ready to give up my profession because I hated the way I practiced. I didn't make patients better, I believed.
Frustrated, job frustration.
Yes, I called it the revolving door theory. Patients would come in, see me, complain about a specific symptom. I would put them onto medication, or I would treat their heart attack. And then they would come to me and say, "Doctor, I can't lose weight." And I would say, in my mind, that patient's eating too much. That's why they can't lose the weight. And I would adjust the medication, and they would leave, and 3 months later they would be back in my rooms. And it leads to a certain level of frustration because you're not making people better from their condition. And after about 18 months, I went and I researched, and I found exactly that there's a completely different way to approach patient care, something that we were not trained to do so in medical school, as you know. So I went and I taught myself how to assess these patients more comprehensively, how to look at their risk a little bit more holistically, and how to use the best of both worlds. So if they needed a natural product that worked, that has been proven in scientific studies and that has been published, then I was willing to prescribe that product. And when I started using this approach to patient care, I saw a huge difference in terms of my patients and them feeling a lot better, losing the weight, and having to see me less often.
I really, really appreciate what you said about natural products that are proven to work from a scientific point of view. There's a huge controversy at this point when it comes to looking at alternative medicine or natural medicine, that, you know, there is very little evidence to support that the natural products are as effective as what we call the traditional drugs. What's your take, being a cardiologist, in the confines of a consulting room? How do you make those kind of decisions for a patient on when to move them from one product to the other?
Well, the decision to prescribe a natural product, firstly, has to be based on peer-reviewed journal articles and publications that proves that the product does work in a scenario. Once the patients have had all their blood tests done and their assessment done, then the appropriate product can be prescribed based on their results. If you walk into a pharmacy today, there are 10 million natural products all making claims, and you can't take all these products because I say you end up with expensive urine. Okay, so the way
which is true.
Which is true.
Yes.
The way to approach it really then is to have a targeted approach for each patient based on what's clinically wrong with them.
Yes.
So, for example, you know, omega-3 is the most studied natural product ever. And there is sufficient data, for example, to prove that if you take an omega-3 supplement, that you have a reduced risk of a heart attack, that you have an 80% reduction in the risk of sudden death from an abnormal heartbeat, that you have a 50% reduction in depression, that you have a 50% reduction in certain types of cancers like colon cancer, that you have reduced attention deficit disorder in children, all as a consequence of something that we are missing in our diet from a nutritional perspective.
Talking about something that we're missing, I'm a woman in her 30s, and something that's been quite alarming in clinical practice lately is the amount of women that are at risk now for diseases traditionally known to affect men more commonly. Heart disease. You, having run and currently running a women's heart health clinic, tell us a little bit more about this new disturbing research and why women are now culprits, if I could call it that, in the game of heart disease.
Okay. It's a misconception that more men die from heart disease or from heart attacks. In fact, since 1984, more women in the world die from heart attacks than men do. Women are more likely to present later for a number of reasons, either because they themselves don't believe they're going to suffer from heart disease, or the doctors who treat them don't believe that women suffer from heart disease. Women are more likely to die after a bypass, and women are more likely to have a more severe heart attack. Women also present completely differently to men with a heart attack, so the symptoms are different. So traditionally, as you may be aware,
Yes.
men complain of severe pain in the chest, going up to the jaw and down the arm, whereas with women, it's completely different. Women are more likely to present with pain in the abdomen area or in the stomach area, with shoulder pain, with fatigue, and with nausea, rather than actually central chest pain. So it is important that women realize that it is not just men that have heart attacks, and that more women will die from a heart attack today than men do.
Well, Dr. Motara, it's been an absolute pleasure having you. Always a pity that we never have enough time to discuss such interesting topics. And I really appreciate that from an integrative side, patients are going to start getting a superior quality of care.
Thank you.
Well, unfortunately, that's all the time we have today. But before we leave, here's an interesting fact from today's topic. Since 1984, globally, more women than men have become susceptible to heart attacks. Thank you for joining us. Stay well, stay healthy, and have a great weekend.